Hi guys. Welcome to my channel. Before we get started, make sure to hit that like button, also subscribe to my channel. Top 10 biggest health problems nowadays. So make sure to watch the full video. Physical activity and nutrition. Helps prevent or delay certain ailments such as some cancers, heart disease, and diabetes, relieves depression, and improves mood. Physical inactivity often progresses with age, but not always. No need to. Check out exercise and walking programs at your local church or synagogue, senior center, or shopping mall. Just like exercise, living alone or eating alone often leads to poor eating habits. Eating nutrient-dense foods and avoiding the empty calories found in sweets are important for successful aging. Overweight and obesity, prostate and colon cancer. A detailed guide and practical advice on obesity are available from the National Heart, Lung, and Blood Institute at the National Institutes of Health. 14. Tobacco. Tobacco is the leading preventable cause of illness and premature death in the United States. Tobacco use is now called tobacco addiction. The U.S. Centers for Disease Control and Prevention, CDC, says that smokers who try to quit have a higher chance of success with a doctor's help. 13. Substance abuse. Substance abuse usually means drugs and alcohol. These are two areas that are less relevant to older people, but they, like young people, can self-medicate with legal and illegal drugs and alcohol, which can lead to serious health consequences. In addition, older people may intentionally or unknowingly mix drugs and consume alcohol. Our stereotypes of older people prevent many health professionals from asking them about their substance abuse potential. 12. HIV/AIDS. Between 11% and 15% of AIDS cases in the United States occur in people aged 50 and older. Between 1991 and 1996, her AIDS among adults over the age of 50 increased more than twice as fast as her among young adults. Older people are less likely to use condoms, their immune systems naturally weaken with age, and HIV symptoms, fatigue, weight loss, dementia, rashes, swollen lymph nodes, resemble those of aging. Again, stereotypes about aging associated with sex and drug use lead to little recognition of this problem. For this reason, older adults are underrepresented in research, drug trials, prevention programs, and intervention efforts. 11. Mental health. Dementia is not part of aging. Dementia can be caused by illness, drug reactions, vision and hearing problems, infections, nutritional imbalances, diabetes, and kidney failure. Dementia, including Alzheimer's disease, has many forms, some of which are temporary. Accurate diagnosis involves management and assistance. The most common mental illness later in life is depression. If left untreated, depression in older adults can lead to suicide. Here are some amazing facts. Older white men have higher suicide rates than any other age group, including adolescents. 10. Injuries and violence. Falls are the most common cause of injury, trauma, hospitalization, and injury death in the elderly. 1 in 3 seniors, 65 and older, falls each year. Strategies to reduce injury include exercise to improve balance and strength, and a review of medications. Home modifications can help reduce injuries. You need home security to prevent robberies. In-house fire protection systems must be available and easy to use. People over the age of 65 are twice as likely to die in a house fire as the general population. 9. Environmental quality. Pollution affects us all, but government research shows that low-income racial and ethnic minorities are more likely to live in areas exposed to environmental risks. Shown to be high. Compared to the general population, a higher proportion of the elderly lives just above the poverty line. 8. Vaccinations and influenza and pneumonia are among the top 10 causes of death among older people. The emphasis on influenza vaccination for older adults has helped. Pneumonia remains one of the most serious infections, especially among women and the elderly. 7. Access to health care. Older people often do not monitor their health very seriously. Although there is a national geriatric shortage, URMC has one of the largest groups of geriatricians and geriatric professionals in any medical community in the country. Their access to healthcare is as narrow as is URMC, and they offer a variety of services at multiple hospital facilities, including his VA hospital in Canandaigua, senior housing, and the community. How do professionals identify threats to public health? Public health professionals identify and prevent health problems that affect entire communities, regions, or populations, e.g., children and the poor. 6. Antimicrobial resistant microorganisms. If I had to name one public health threat, not just in the United States, but in the world, it would be antibiotic-resistant bacteria, says de Bernardi Schneider. These superbugs have become more resistant to treatment after antibiotics were often prescribed in unnecessary situations such as viral diseases. The increasing resistance of bacteria, parasites, viruses, and fungi to drugs makes certain diseases such as tuberculosis, HIV, and malaria more difficult to treat each day, says de Bernardi Schneider. Patients prescribed antibiotics are advised to take a complete course to slow microbial resistance. 5. Air pollution. Air pollution is a global public health concern and was ranked by the World Health Organization, WHO, in 2019 as the #1 contributor to diseases such as cancer, stroke and cardiovascular disease. Environmental health risk. The WHO estimates that 7 million people die each year from diseases caused by air pollution. Air pollution is caused by everyday activities in homes and businesses that burn fossil fuels. While many parts of the world are working to reduce their air emissions, the CDC uses the Environmental Protection Agency's EPA Air Quality Index to measure air quality before people spend time outdoors. We also encourage controlling exposure to pollution. 4. The opioid epidemic. Opioids are a class of drugs that include fentanyl, heroin, and prescription pain relievers such as oxycodone and morphine. Opioids are highly addictive, and dependence and abuse of these drugs have increased over the decades. The opioid epidemic was declared a public health emergency in 2017, and opioid use caused 68% of drug overdose deaths in the same year. Healthcare providers, pharmacies, and government agencies are now working together to reverse this crisis. The Department of Health and Human Services, HHS, offers its 5 guidelines for reducing opioid abuse. This includes improving access to rehabilitation services, developing better ways to manage pain, and using medications to relieve overdose. 2. 3. Obesity. Obesity is associated with 9,300 million adults and over 13.7 million children and adolescents. 3. Obesity is not overweight. It is recognized as the leading cause of premature death from related diseases such as type 2 diabetes, heart disease, stroke, and some cancers. CDC recognizes that obesity is a complex problem with no simple solutions. It arises from a variety of factors, including genetics, physical activity, access to adequate nutrition, and community environment. CDC provides educational tools to promote healthier lifestyles in all communities, including community resources to promote nutrition and physical activity education. 2. Alcohol and tobacco use. These may not be the most surprising things on this list, but both alcohol and tobacco use will have public health implications for years to come. It has a wide range of potential impacts. Tobacco use is associated with increased cancer, heart disease, lung disease, diabetes, and immune system problems. Excessive alcohol consumption has both short-term effects, such as alcohol poisoning and injury, and long-term effects, such as liver disease, high blood pressure, and certain mental health problems. Regulations are becoming more common, and increased education about the risks of these activities is regularly used to address these public health concerns. 1. Influenza pandemic. Influenza pandemics occur when a disease spreads rapidly around the world, infecting a significant portion of the world's population. These pandemics have happened 4 times in the last 100 years, most recently in 2009. Experts believe another flu pandemic will occur soon. States have developed their own plans to protect residents from this public health threat in the event of an outbreak. WHO is also making influenza vaccines and other resources available to countries around the world, especially developing countries, to prevent this public health threat from becoming a reality. Examining the state of public health. These public health issues affect people around the nation and the world. Thanks to the public health professionals who work to solve these problems, we can all look forward to healthier communities in the future. What do you think of our video? Let me know in the comments section below. If you enjoyed this video, make sure to hit that like button. Also subscribe to our channel before you go.